I was also doing a mold protocol at home
Mhm.
with the nebulizer and something that I was
Yep.
getting to put in there,
Yep.
So I started off with all that. And, it's just really is an investment in yourself. I said to myself, okay, you know what I was doing was not working. And whatever it takes is what I'm going to do because I have to be here for my child. I want to see my daughter graduate. I want to
That's
see her
right.
walk down the aisle.
That's
I
right.
want to be here to help her with her children. And I have to get better. So whatever it takes is what I'm going to do because what I really learned through this journey is your health is the most important. It really does not matter what car you drive, what your house looks like, how much money you have in the bank. If you do not have your health, you have.
Welcome to the Deeper Healing Podcast. I'm your host, Danielle Howley. This is for everyone who's been dismissed, misdiagnosed, or told to just live with it and refuse to accept that answer. You're going to hear amazing patient recovery stories, raw and real in their own words. People who found answers after everything had failed them. You're going to hear from medical experts we trust that are pioneering new approaches to healing the body because we deeply know we're designed to heal. Let's dig in. Okay, everybody, Deeper Healing here, our Deeper Healing podcast. We're here today with a guest. I'm literally so excited. I've been actually counting the days to Angela Green's podcast because you're such an amazing person. You're a mom. You're a young mom, new baby. Which is probably not a new baby anymore, but
Yep.
Young mom and a teacher and just has been through quite a journey of health stuff and come through it with miraculous, amazing. So why don't we start off with where did this begin?
Wow, where did this begin? So, when I think back to everything that I have dealt with in the last more than a decade, I can really trace it back to being in high school, college. I remember having chest pain, having these heart palpitations. I guess I would describe it kind of like heartburn. I didn't really know what it was. My mom was taking me to different doctors, my primary doctor and all this. And they're like, oh, it's just heartburn. They gave me some kind of prescription. Would take it when you're eating spicy foods or, whatever. And it wasn't going away. It would still happen every now and again. And then fast forward to this horrible episode that I experienced when I was in college. We went to go visit my brother because he's a Marine and he was stationed down in North Carolina and I grew up in Ohio. And so we went to visit him and I got really, really sick. And I mean, I cannot even explain to you how sick I was. The only way I can explain it is think about a college student who is so sick that crawls in the bed with her parents. She's sick. Okay. I literally got in bed with my parents when we were sleeping at my brother's house. And I'm like, I am so sick. I don't know what's wrong with me. My throat was hurting so bad. I had a really bad fever. I had all these white patches in my throat. I was just really, really sick. And they were like, well, you probably have strep. I don't know what's wrong with you. I was really fatigued. They took me to some random doctor there. I mean, we were out of town and they didn't really know what was wrong with me. They were just like, oh, well, she's sick, take Tylenol or whatever they probably told my parents to give me. And I was really sick. And then the whole trip, super sick. On the way back home, because we drove from Ohio to North Carolina. On the way back, I was sitting in the front seat. And this is one of the scariest moments of my life. My mom was driving, my dad, my siblings are in the back seat sleeping. And all of a sudden, I just started getting this chest pain again. And I was feeling like I was going to pass out. And I'm trying to tap my mom. And I'm like, something's not right. I don't feel good. And I'm holding my chest. And I blacked out. And my dad apparently, because my mom, she's like me. She can panic in situations like that. So my dad is a little bit more calm. So
I can't even imagine I'm driving.
Yeah.
And my kid goes unconscious.
Yeah, right.
Oh my gosh.
I was literally blacking out. And I the last thing I remember is I heard my brother saying Ange, wake up, tapping me. And I don't know. And then I kind of came to, and my dad's now in the front seat, driving and putting in the GPS. I mean, this was back in the day. So, you had your little Garmin. You didn't have all that on your phone. We had the MapQuest on the way down to North Carolina.
I printed it out.
Yeah, you couldn't do all that. So
I still have an atlas in my back seat. So I'm not judging.
So my dad gets us to a hospital, somehow found it in the GPS because we were, I don't know even what state we were in. we didn't know where we were at. We get to the hospital. Again, they couldn't really figure out what was wrong with me. And I'm like, I am so sick. Like, why can't they figure out what's wrong with me? So we got a hotel that night, stayed in the hotel, went back home the next day. They're like, follow up with your primary care doctor. Okay. So they were like, oh, we don't know. We can't explain like what's wrong with you. I don't even remember if they did blood work. I don't know. And then fast forward to, I'm in college. So, I'm trying to be in shape. I'm going to the rec center, working out, going for jogs, all this stuff. And I remember this one time I was jogging the track in the rec center at my university, and I just started having all this chest pain again. And I'm like, I am in college. I'm not an old person. Why am I having all this chest pain? And to the point where I had to stop running. So then I told my primary care doctor. They did the stress test. They had me running on the treadmill with all the things. I don't know. I guess it's called the stress test for
Yep.
your heart or something. And they're like, oh, it's just your heartburn. Or, they're telling me like, oh, it's just that. Take this medicine, you know. And I'm like, I am just so sick. And then I kept just getting sicker and sicker. At one point, I remember getting blood work for my thyroid, and I kind of panicked a little bit because it was a little bit off. I don't remember if it was high or low, but my sister has chronic, she has type 1 diabetes, and she has other chronic things going on, and she has a thyroid issue. And so I called her immediately, and she's like, oh, it's just a little off. It's probably fine. They didn't give me any medication. I'm like, okay. And then keep moving forward. I'm like,
Well, so so this was high school, then college, right? You're slowly progressing. You're like, whatever
yes,
this original thing has never resolved. No one's
right,
ever figured it out. And now you're progressing.
right.
So now
then
are you out of college? Are you married?
So now I moved down to Charleston.
Okay.
I graduated college. I taught for a year in Ohio, and then I moved down to Charleston. I started teaching at a school here, and I was in like a little trailer. And, I would see little things, at our school, we were outgrowing it. So I was definitely, we had a lot of classrooms and trailers, and I would see some kind of looks like mildew, like on the walls and the paneling and all that. And I would, they would put a work order in for it. They're like, it's not mold or anything like that. They would, clean it off, put it like a humidifier or whatever in, your classroom. And I was in that trailer for maybe 7-8 years. And I remember having a lot of chronic sinus infections, like super chronic. I mean, probably every month I was getting a really chronic sinus infection. And there was times where I would just bend over to do something and liquid would just pour out of my nose like a faucet. I'm like, that's not normal.
Yeah.
Like, I don't think that's supposed to happen. I would tell people that, and they're like, what? I'm like, no, seriously. I mean, I could just bend over even when I wasn't sick. And I mean, it was just like a faucet. It was really weird. Anyway, so I would go to the little CVS Minute Clinic, and they would test me for strep throat. Sometimes they told me I did have strep throat. Sometimes they told me I didn't. And they would still give me an antibiotic, which I now know what's the point if it's something viral and it's not strep throat. Like, why are you giving me the antibiotic? That's not going to work for that. Well, I know better now. So, of course, I took all the drugs they told me to take, and I was super sick, and I would get really fatigued and just horrible, really bad sore throat, just really felt crappy all the time.
Were the other things still popping up too? Were you still
Yes.
having, so now you're having the heart palpitations, the
Mhm.
heartburn, and the exhaustion, and the chronic. So now the symptoms are just like piling on top of each other.
Right. And I'm just like seeing these in my mind at the time as very isolated things. Like,
Of
these don't all
course.
connect.
Yeah.
They're not, it's weird. But I always thought it was weird that all these things are happening to me. I'm like,
And how old were you?
at that time, I was in my early 20s. I mean,
Okay,
I was
so
like,
you're young.
I mean, I
Yeah.
had just started teaching and all of that. And so, or probably mid 20s. Yeah, at that time. And I was just really sick all the time. And then I met my husband, and we got married in 2016. And a month after we got married, we were at a friend's house. It was a birthday party, and, we're having a few drinks and all that. And I started getting these really bad chest pains. Like, I thought I was having a heart attack, and nobody would listen to me. Like, everyone there's drinking and partying and having fun, obviously. So I'm like, y'all, like, I think I'm having a heart attack, you know? Like, oh, no. I'm like, no, seriously, something is wrong with me. I sat down for a little while. Somebody else's friend or whatever that was there was a nurse. And so she was kind of like checking my vitals and kind of checking on me and just trying to kind of figure out what was going on. I don't know. It kind of eased off a little bit. My husband and I actually left early from the party, went home. I'm like, okay, I don't know what's going on with that.
But it was worse than before. This
Yeah.
was worse than the
Yeah, it
others.
was not good. It was not good. And I ended up going to, I think the doctor at that point, and I think they tested me, did some blood work and found out that my thyroid was off. And I'm like, oh, okay, they had told me that at one point in college, and this is a different doctor and all this. This is, down in Charleston. And so I was like, okay, so I have this thyroid condition and they're like, yeah, it's hyperthyroidism. Like it's really high. Yours is really unsafe through the roof. Your resting heart rate is like 140, 150. I'm like, "Oh, okay, that doesn't sound good. And so they gave me some kind of prescription. What do they give to like heart patients when they're
Beta blocker.
yes, a beta blocker. That's what they gave me. I started gaining weight and feeling like crap.
Yeah,
All
that
these
slows
things.
everything down.
Yeah, they gave me a beta blocker and they were like, we're not going to give you any prescription for this thyroid because you have to go see an endocrinologist. I'm like, oh, what's that? And then after talking to my sister, she's like, oh, well, that's who I see for my diabetes and all those things. I started learning like, okay, what do these different doctors do? So nobody would give me a prescription for my thyroid, just the beta blockers, because I have to go see this like specialist. And at one point I was at work getting my classroom set up. It was the beginning of the school year.
Back in the
So this
trail,
was like a
back in the
month.
moldy.
So like a month later, actually, I was in a new trailer by then.
Okay, good.
Somebody else was in my trailer, but when the new trailer came, I was like,
Okay.
I want that one. So anyway, I was, oh my gosh, it was really scary. I was in the hallway because we all had to have like a display in the hallway of student work, even though we were like in the trailers. So I'm setting up where the display is going to be for the school year, where I'm going to hang all my students' work. And I'm standing there and I just remember feeling lightheaded and my chest, like, I'm having these heart palpitations again. I'm like, what is going on? And I fall to the floor. And one of my teacher friends is like, oh my gosh, she runs to go get the school nurse. They put me in like a little wheelie chair, take me to the clinic. They're like, your heart rate is like 155. And I was just standing there doing nothing. I mean, some people are sprinting down a
Mhm.
track and they don't even get to 155.
That's right.
Mm-hmm.
I mean, isn't like a normal heart rate
Mhm.
like between,
Mhm.
I don't know, 80 and 100 or something like that? I mean,
Usually
155.
120.
Okay, so
Yeah.
like, I mean, if I'm just standing there doing nothing, you know. So they called an ambulance and I was like, oh my gosh, this is so embarrassing. I do not want to leave my job in this ambulance. This is ridiculous. And of course I did because they were like, you have to. You cannot drive yourself. This is not,
Yeah.
you need to go get looked at. Of course, my husband is out of town for drill. My family's in Ohio. I'm like, oh my gosh, I'm going.
gosh.
So my teacher friend meets me at the hospital and I called my mother-in-law and my in-laws and my sister-in-law. They came, they live like an hour away in Manning. So they came and they were there with me in the hospital. And I told them all the things that, I had just recently been diagnosed with this thyroid disorder, but I wasn't on any medicine. They're like, well, you need to get on something ASAP. So the doctor in the emergency room prescribed me something for the hyperthyroidism. So I think I was put on methimazole or something
Mhm.
like that. So I started, taking that. I went home from the hospital. I did notice like a little bit of a difference. I wasn't having like the heart palpitations as much. And I got myself one of those little pulseometer things,
Yeah. So
whatever.
you could like
So I could
see where
check my
you
heart
are.
rate at home because now I'm like paranoid. My heart rate's getting up and then, months and months went on and my husband and I had just gotten married in July, right before that school year started. And, we wanted to have kids. And I was like, oh my gosh, I started doing this research and I'm thinking, oh my gosh, maybe I'm not going to be able to have kids because now this is like an autoimmune disorder. And eventually I did get linked up with an endocrinologist and all of that. And, he said, you have Graves' disease. And I'm like, that sounds
Oh,
kind of
wow.
serious.
Okay.
So I get diagnosed with Graves' disease and I'm doing the medication I don't know how often I was going, every 6 weeks or whatever it was. He would check my blood work. The only ever thing he ever checked for was, thyroid. He never checked for anything else. It was just that every once in a while, like if I said I wasn't feeling well, I think he would check like my B levels or something. And yeah, and so he would just adjust the dose. He would say, okay, take more, take less.
And that's like a no treatment, no cure autoimmune condition.
Yeah, I mean, he
this
pretty
is-
much told me, your options are you can either take this radioactive iodine or something to kill it
Mhm.
off, which I'm pretty sure causes cancer. Or you can just have surgery and have it removed. And I wasn't willing to do either one of those. I was like, both of those options seem kind of scary to me. I just got diagnosed with this. Let me just wait it out and see what I can do. So my husband and I ended up conceiving like 6 months into when, we had gotten married. So that December, like, or January, whatever, we found out, I was pregnant. I was super excited. And then obviously the focus was on that. I still wasn't feeling my best. They altered my medication and gave me something else that begins with a P. I can't remember, but something that's more safe when you're pregnant, I guess. So I went through my pregnancy, had to see a specialist and all of that kind of stuff. And then because, with a thyroid condition, I guess. And I don't know, they considered me like old or something. If you're
High
over a
risk.
certain age, you're old. I'm like, I'm not even old. So anyway, but yeah, so then
I'm wondering where deeper healing came into the field.
yeah.
So, because I know you had your daughter when we saw you.
Yeah.
So,
She was already born. So after I had her, I guess I started becoming what they call a crunchy mom or whatever, because after my daughter was born, you want the best for your kid. And so you start doing a lot of research and you research everything that's going into your child's body, that's going on their body. And that was me. I was researching everything under the sun, and I hate when people say, oh, you don't know anything. You're not a doctor. You're just learning that online or on Google. Well, newsflash, people, it's 2025. Do you go to the library and check out a book every time you want to research something? No, you research online like
I have to
everybody
say,
else.
becoming a new mom was a big epiphany for me too.
Yeah.
I don't know why it was different.
Yep.
Like for me, I
Mhm.
wasn't worried. But when I had my son prematurely, I literally remember walking into my house and I said to my husband, every chemical in this house has to get out.
Yeah.
Like
Mhm.
today, I
Yep.
want it out of the house.
Yep.
I don't want any chemicals near this kid.
Mhm.
It was like, why was it okay the day before?
Yep.
Didn't even make sense.
Yeah.
But
And I
it's
had
something
friends that were
about
like
that.
crunchy moms and they were starting to teach me stuff, or they would tell me things to look up and research. Like, I'm not telling you what to do, but I just want you to look into this or look into that. And I started doing that. And I'm thinking, oh my gosh, I am like living in a really toxic world right now. But
Yes.
it was so overwhelming. And I'm thinking, where do I start? And, I had friends helping me and I'm like, okay, I'm going to start here and I'm going to start there. And I'm going to look at this laundry soap and we were doing cloth diapers and all the things. And I'm like, oh my gosh, what am I washing this in? And, so I started kind of going down that rabbit hole already. And then had, friends of mine that are saying, hey, you need to do this for yourself. Like you need to seek someone else. Like, I know you're going to this endocrinologist. You need to look for like a functional medicine doctor. You need to look for something else. And in my mind, I didn't even know, like that was foreign to me. I just knew the very traditional Western conventional medicine, I knew nothing about that alternative side of medicine, the holistic side,
the naturopath,
naturopaths, like
I have to
the
say,
chiropractors.
I was raised the same way. So traditional family,
Yeah.
doctor said boo, you said great.
Yes.
Give me the boo.
Exactly. So I'm like, oh my gosh, well, how do I even find someone like that? And I had started going to this little herbal store that was close where I lived. And I was getting ingredients and herbs there because I was starting to make my own homemade elderberry syrup and all of these things that my friend was teaching me how to do. And I picked up this little magazine and it was like a little health magazine. And in the back, it had all these different people in the area.
Natural awakening.
Yes.
Say that.
Yes, that's what it was. And so I'm seeing these chiropractors and doctors and all these people, right? And there's Dr. B's picture, and it's just a little clip. And it said something like chronic illness and whatever else. But when I read that, I'm like,
this is the one.
this is the one.
Like it jumped out at you.
This is who's going to have, like, it was like God was telling me,
yes,
that's where you need to go.
Yeah.
That's where you
I
need to
love
go.
I
that.
love when that happens.
And I was really nervous to like make that first phone call because I'm like, what am I even doing?
yeah.
What am I even doing right now? So when I called that phone number, it was you.
me? I was going to
It
say,
was
I used to
you.
do all the
Cool.
calls. I used to do
That was a long time ago. So
Yeah.
it was you. And oh my gosh, I could cry. Your voice on the other end of that line was like, it was hope for me. It really was. And I just remember you being like, you need to get in here. Like we can help you. And oh my gosh. So I took a leap of faith and there I went, and that was when you guys were in the other building.
Yeah, we were at
Yeah.
1300 Hospital Drive. You know,
Yep.
it's funny about that. Yeah, I feel like you've always been the biggest cheerleader for deeper healing and always like even with, saying crunchy mom, like, I
Yeah.
feel like we always got into those conversations
Yes.
too, because we're like really trying to do good by our children.
Yeah.
And like, we love, love, love moms like you,
Yeah.
who are like, wait a minute, is this right? I
Yeah.
don't know if this is right.
Right.
Like just trying to figure
Yeah.
out. It's so hard to figure things out.
And I remember
know?
when I was first starting to tell like family and friends, I'm going to this place. It's called Deeper Healing, Dr. B, all this stuff. And they're like, oh, he's not even a real doctor. They're saying all these things. And I was like, well, first of all, you know, I'm like, first of all, he worked in an emergency room for 20 years. I'm pretty sure he's a real doctor.
Yeah,
Okay.
yeah,
Yes, he is. By the way.
That does do it for people. Like, he ran in
And
the
they're like,
ER for 20
oh.
years.
They're like, okay. So, and then I just kind of had to block out the haters and be like, I got to do what's best for
you
me.
got to block out the
Clearly what I'm
haters.
doing is not working. So I got to do something else. And again, I had a baby at home. I'm trying to figure out what I can do to get healthier because I want to be that mom running around at the park with her kids. I was barely getting out of bed every day. And when I sat down with Dr. B.
So you kept progressing down.
Yeah. 100%.
That's what I kind of want to hear. Like, so
Yeah.
your kid was like how old when you made the
So
call?
when I made the call, I want to say that she was probably, it could have been like maybe a
Like a couple
year
months?
and a half.
Okay, so she
something
was on
like
maybe
that.
a
She was
year. So
little.
you had gone through like
between a year and 2 years, something like that.
a whole year of new mom feeling like
Mhm.
shit,
Yeah.
basically.
And think about like being postpartum and your body is messed up. Okay. And if I was in a better place as far as how I was feeling, I feel like I would have breastfed longer. I only breastfed her for like the first 6-7 weeks because I got so overwhelmed. I was feeling horrible. I just feel like it robbed me so much of what I wanted to do as a mom because I just could barely function.
Yeah.
And were you
You
still
know?
getting sick all the time?
Yeah.
And the
Yeah.
sinuses, so you were having like the chronic fatigue,
Yep.
sinus problems.
Yep.
And you
In
were
the house that we were living in, which we don't currently live in, I would tell my husband all the time, when we would be away for the weekend and come back, I'm like, don't you notice the smell in that house? Like, it smells musty to me. And he's like, well, it's built in the 70s. It's old, I'm like, listen, that is not normal. Like, it just smells musty to me. And he apparently can't smell anything, but I feel like I can smell things. I'm like, this doesn't smell right. I just knew
You're
I was
getting it from home and from
yes.
work.
And
So you're literally
now we
having,
don't live
like-
in that house and we've never had it tested. So I don't really know for sure. But,
Yeah.
I felt like, I don't know, something's making me sick. Like I am getting sick. So when I first started going to see Dr. B and I sat down with him, he was, and again, I was kind of already going down that road of being a crunchy mom. So I knew things and I knew there was things I needed to do, but I just, I was taking small steps. It's overwhelming. You can't do everything all at once. You can't change your pots and pans and your water and all, it's a lot. It's
It
a lot,
is.
you have to take it one day at a time. But when he pulled up my zip code on that website or whatever he uses, and he pulled up and showed me what is in my water,
EW.org.
Yes. I was like, oh my gosh. Now I'm just not a tap water drinker. So I never really drink tap water a lot, but just knowing that I'm using it for cooking and bathing and all the things. And my husband was fine with drinking tap water. So he was drinking it. And I'm like, oh my gosh. And so, he was starting to tell me all this stuff. And I explained to him why I was there and everything I was going through. And he's like, first of all, we need to do some blood work. We need to see where we're at, what's going on. So then I came back. And when I sat down with him for that very first time, first of all, I had never gotten that much blood work done in my life. I was like,
No,
pages of stuff. I'm like, I've never even seen anyone test for this stuff
know.
before. What is this?
I just say that out loud. I say that
Yeah.
all the time. Everybody deserves that. Even
Yep.
just
Yeah.
one time a year
Yes.
or every other year. Like, where am I?
Yeah.
Like, we
Mhm.
go our whole lives
Yep.
with like
Yeah. And
a cholesterol marker.
it's
You know what I
amazing.
mean?
Like it was so eye opening. And he's explaining to me how everything works together. And this is telling me this and this is telling me that. And he is, he's brilliant. So he's just
So
spitting
brilliant.
that stuff up. And I'm like, whoa. So it took me a minute to digest all that. But and I know I've teared up telling you this before, but the main things that just stuck out to me was when I sat with him and he looked at that blood work and he looked at me right in my eyes and he said, I don't know how you get out of bed every single day. And I was like, I don't know how I do that either. He's like, these numbers I would expect from someone who cannot get out of bed every day. And I had I had my daughter there
Yeah,
with
I
me.
remember.
Rosie was
I
there,
remember.
and probably climbing all over the floor, whatever.
Mm-mm.
And I said, "This is why I get out of bed.
That's right.
I don't have a choice.
Yeah.
I'm a mom. This little tiny human, she depends on me.
Yeah.
I have to get out of the bed." And finally, I felt heard because when
Mm.
you have an autoimmune disorder, and my sister and I talk about this all the time, when you have an autoimmune disorder, you really feel like you're suffering in silence because people don't see you as being sick. They don't see those physical signs. They don't see a cast on your leg. They don't see you in a wheelchair. They don't see any of that. They don't know what is going on inside your body, and they don't realize how chronically ill you are.
I've had
And
more Epstein-Barr people say to me, I wish I had cancer because
Mm,
someone would bring me a casserole and watch my kid.
mhm.
Like I'm trying to I can't get out of bed and
Yeah.
have no support.
Right.
And I'm like,
Yeah.
wow,
They don't
when
see you as being
when
sick. You
you're
don't
wishing
look
for
sick.
cancer, this is
Yeah. Oh,
sad
yeah.
affairs.
And I mean, and God bless my husband because he is just, God gave him to me for a reason because he is so calm and he's so understanding and but there was times where I just felt like a really crappy wife. I'm like, I should be doing all these things for him. I should be, like cooking dinner right now, or I should be doing this, or I should be making sure. And
And you're like, I have to
sometimes
lay
I just
down.
couldn't.
I have to lay
I
down.
just couldn't. And I would do what I could and I would push through. And even sometimes I never told him how sick I felt because I didn't want him to carry that burden either. And I was working a full-time job. He's working a full-time job. We're both busy people, and sometimes I just felt like I'm not pulling my weight. And he would never say that to you, because he knows how hard I work. And I know I work hard, but sometimes I just want to do more. I'm just that person where
Yeah.
I feel like I should always be moving,
Mm.
always on the go. And sometimes I just couldn't. I just
Yeah.
needed to sit down. It's horrible
That
feeling like that.
the chronic illness loop is a wicked loop.
Mhm.
I've been on that ride.
Yep.
And Marty's been on that ride and, not a good wife, not a good mom, can't socialize. No one sees, you just like, oh, I can't make that.
Yeah.
Then you don't get
Yeah.
invitations because
Right.
you say it enough times.
Right. And I've
So
always been a
many-
very social person. I was the one that, like my mom would say when I was a kid, everywhere we went, you made a friend.
Mhm.
I was very social, had lots of friends, but I don't know. I just wasn't doing things as much.
Yeah.
I became a mom. I'm like invested in her. I'm super sick all the time. So the days that I am functioning well enough, I'm taking care of my kid. I'm, taking care of the house. I don't even have time to go anywhere or do anything with my friends. I just became a shell
Isolated.
Yeah.
of myself.
Yes. My
You know,
God,
that's just-
yes.
That's how I felt.
Marty used to say that all the time. I'm just
Oh.
a shell of myself.
Mhm.
I'm not myself. Okay. Bring me some hope and joy. Bring it to me.
Yeah.
And so I had done a little bit of research on Epstein-Barr virus, and it's
Was that something that showed up for you?
On the
It
labs?
did.
Okay.
It
Okay.
did.
Yeah, I'm
And-
really curious. I kind of want to pull
Yeah,
the
because
labs up.
Yeah.
it always says no treatment, no cure.
Right. And
That's-
I was already doing a little bit of research on that because I saw that it was connected with autoimmune and
Yeah.
thyroid things and all that stuff. And Dr. B sat down with me. He was like, you have chronic Epstein-Barr virus. And these numbers are showing, I guess you can see
Mhm.
if you've had a recent flare up of
And
several
yep.
months or whatever
Or
it
a
is.
past
or-
infection. It's
Yeah.
different titers.
Right. And so he was like kind of explaining all that to me. And he's like, yeah, you definitely have it. And you've had a recent flare. Have you recently been sick? And I'm like, yeah. And I'm explaining to him. And I'm like, okay.
Back to the car ride or when you were sick.
Yeah.
And
And so I'm like, now years later, I'm going back thinking that episode that I had when I was in college, when we were visiting my brother in North
Mhm.
Carolina, I think that was my first exposure or
Mhm.
first time having, because it really is like mono, basically, the Epstein-Barr. I think that's when I first got it. That's when I first had it. I was super, super sick. And then ever since then, every single time that I've been really sick like that, I think those are flare-ups that I was
Mhm.
having of that Epstein-Barr. And that's why when I was going and they were testing me for strep, I mean, of course, there was times that I did have strep, but then
Yeah.
there was a lot of times where they were like, no, it's not strep. And I'm like, well, then what is it? What is wrong with me?
Yeah.
And I feel like it was that every single time.
yeah,
that I was
once
super
it's
sick.
there, it's there. And
Mhm.
it can just flare and
Yep.
it's like a roller coaster
Mhm.
ride depending on the stresses in your life, what you're
Yep.
exposed to, what's
Yep.
going through.
And then he ended up testing me for mold because, oh my gosh, I could remember filling out that first form that Deeper Healing gives you.
Do you smell a musty
like where
smell?
you live, like where all these things. And I'm like, my gosh, this is personal, like there's so many questions on there, like just about everything. But it's so important to fill that out and to be truly honest on there because otherwise, you can't help.
That's
Oh,
a mic drop. That because people are always like, "Oh, I hate filling out the paperwork." I'm like, I guarantee you, the questions that you're going to get asked,
mhm.
you've never been asked
Yes,
before.
because then otherwise
Because
nobody knows how to help you or what to
they-
test you for, or what to look at.
we're going so much deeper,
Yeah.
all the way back to birth, all the way back to like, how were you born? Like,
Yeah,
it's
exactly.
amazing.
And that's when he was like, we need to test you for mold. And I'm like, mold, and he's telling me like how you can be very chronically ill from that. It can cause chronic sinus infection. I'm like, oh, ding, ding, ding. That's me, and just other things. And so, yeah, so he tested me for that. And sure enough, there it was. I had lots of mold and
mold
things in
mold
my
will also
body.
hold that immune system down to let
Yep.
let those dormant viruses really flare up.
Yes. Yes.
Wow. So mold. Okay. So mold at school, mold at home. Your mold levels are high. Your Epstein-Barr's
Mhm.
off the charts. He can't believe your blood work.
Yep.
So he's like, get your butt in here and start
Yeah.
getting treatments.
Mhm.
So you probably did UVB ozone for sure.
Yeah. And I was doing the
Cleanse,
cleanse, with
Rejuvenate.
oxygen and all
Yeah.
that. And
game changing.
And I was also doing a mold protocol at home
Mhm.
with the nebulizer and something that I was
Yep.
getting to put in there,
Yep.
So I started off with all that. And, it's just really is an investment in yourself. I said to myself, okay, you know what? What I was doing was not working. And whatever it takes is what I'm going to do because I have to be here for my child. I want to see my daughter graduate. I want to
That's
see her
right.
walk down the aisle.
That's
I
right.
want to be here to help her with her children. And I have to get better. So, whatever it takes is what I'm going to do because what I really learned through this journey is your health is the most important. It really does not matter what car you drive, what your house looks like, how much money you have in the bank. If you do not have your health, you have nothing.
You have nothing.
Amen to
You
that.
have nothing.
Mic drop.
Well, and it's sad because we hear this all the time. It really takes you hitting that rock bottom point to
Mhm.
like really realize that. Like
Mhm.
people just take their health like to their advantage,
Mhm.
thinking
Or even like, when you had said, we had a guy on here recently on the podcast, he talked about he was sluggish for years, but he kind of got used to it.
Yeah,
Like it
becomes their
almost
normal.
becomes
Oh,
the
yeah.
new
It becomes
normal.
their normal for me. Like,
Yeah.
I almost didn't even know what it was like to feel well.
Well.
Yeah.
Mhm.
You're like, oh, if I'm not in a bad flare, I'm doing
Mhm.
well. Like it's almost like
Yeah.
your norm becomes like
Yep.
lower and lower,
Mhm.
Well, you have a whole new appreciation of life when you
Yep.
can't. I mean, you're just literally struggling every day,
Yeah.
and every day is just like, okay, get through the day, especially as a new
Mhm.
mom and having like the mold. Did you have,
Yep.
we call it mold brain, but did you have the focus and
Oh,
the
yeah.
brain
I had
fog
some
and
brain
like
fog. I thought, okay, this is just due to being a recent mom. Like, when you go through pregnancy and all this, I'm like, okay, I'm still having brain fog sometimes. Sometimes I'd be at work and I'd be in a meeting or something. And I'm like, I can't respond as quickly as I should
Yeah.
be able to. This is not normal. And then at this point, I had started transitioning. I went to a different school. I was teaching somewhere else. All these school buildings are very old. And by the way, they don't really keep the air on in the summer. So what do you think
I
happens
know.
when
Don't even get me started.
they're sitting with no air conditioning on all summer
We
long?
see
That's
the
just a whole
kids
nother
and the
thing,
teachers at Deeper Healing all the time. And honestly, we make paper houses on swamps. I
Mhm.
mean, literally.
Especially here
Yeah.
in South
We
Carolina.
make paper
Yeah.
houses on
Mhm.
swamps. And then we wonder why our houses have mold.
Yeah, I know. And it's just a constant thing that you have to always, be taking care of your health and
Yes.
keep up with all of
Mm.
these things that are,
Yep.
are great for you and make sure you're living in a mold-free environment because it's really hard to control when you're out in the workplace and
Yep.
I mean, it's almost impossible to get away from it. But I was starting to have some other really scary symptoms. I would be at work typing on my computer and my whole arm would be so painful to the point where I had to go to my, principal at the time. And I'm like, I cannot even type emails right now. Like, I cannot even do anything. My arm was just so sore. It just felt like I can't even describe the pain. It was the craziest thing. I'm like, what is wrong with me? You know, it was just so many different things. But I was started seeing Dr. B. I was doing the things that I should be doing. My labs were, getting a little bit better. And then I think I kind of like took that for granted, and I was living the mom life and trying to focus on my kid and all those things. So then I would go this like long stretch of time without checking in with Dr. B and all this, and then I would start feeling really, really sick. And then anyway, so fast forward, I ended up moving out of that house that we were living in. I ended up going back to the school that I was at previously, but it's a brand new building. And I'm like, okay, this is good for me. I'm in a new house. I even went with the person that Dr. B suggested that they can actually come to your home and do an air quality check.
Oh, cool.
And that was really eye-opening because there was a house that we were going to buy. We put an offer in on it and we had that air quality test done. And, I kind of noticed a little bit of a smell in the house, but I thought it was a dog smell. And I'm like, okay, they had a
Oh.
dog, previously. And we did the air quality test and it was not good. And then I did some more digging and I found the current homeowner, in the Facebook group, all the neighborhoods have Facebook groups and
Yeah.
all that. And she had posted something from like a year before about some water damage that they had
Oh, man.
and showed some pictures and all this stuff, right? And I talked to Dr. B about it and he goes, well, mold can smell different. It doesn't have to smell
Yeah.
musty. It can have that wet dog smell. It can smell like different things. And I'm like, I bet that's what we were smelling in that house. And we did not buy that
So
house.
you dodged a
Good
bullet.
for
We had
you.
put an
That's a big
offer in
one.
on it. And, it was in the process of going and I pulled it and my husband was so frustrated. And,
Mm.
he's like, oh my gosh, we need to find a house and all this stuff. I'm like, I am not doing it. I am not willing to sacrifice my health. I've been working so hard to try to get better.
That's awesome.
And then finally, God was like, that's the house for you. I found this house and I was like, oh, I love this. I love everything about it. I went there. There was no weird smells. I didn't get any weird vibes. We did the air quality test. It was great. I'm like, this is it.
Amazing.
This is it.
Amazing.
And so, yeah.
It was really fun watching you recover. You were,
Mhm.
and I love hearing it cannot be minimized, the attitude of I'm getting better. I'm going to do what it takes
Yeah.
because there's people that are like you
Mhm.
and they do get better and then there's the people who are like, I'm never getting better.
Yeah.
And I always say, well, whatever you believe is true.
Right.
I mean,
And that's something I had to learn too, is like your mindset. And
Mhm.
I think that helped me for, what I've dealt with in the last year too, is like having that positive mindset is super, super important. And I think that's why the brain align and I went through all of that. I think all of that stuff is really important. And that's the great thing about deeper healing is because you're not just focusing on one aspect.
right.
You've got everything. You're diving deep. I can't remember what all the letters stand for, but it's
Yeah,
all
deeper.
fabulous.
Diet, emotion, environment, physical, elimination, rebuilding.
There you go.
It's interesting because a lot of people say that they're like, it's just really nice having everything under one roof.
Yes.
So like if something comes up,
Mhm.
like you mentioned on the way in here today, we'll talk about UVB for a little bit because you're
Yep.
like a poster child for it. And it's my favorite treatment in the world that, it's accessible. It's like
Mhm.
you're a patient. The whole center is accessible to you. If
Yeah.
you need something, there it is. It's not starting a new intake, getting on board with someone, and they're only in this niche. But
Mhm.
that's not the way the body works. The thyroid is not alone.
Yeah.
The thyroid is part of this bigger
Yeah.
system,
Exactly.
So when did you know this is working? Like when did you notice
I
things were
started
improving?
realizing, oh, I'm not getting these chronic sinus infections anymore. I don't have this weird drainage coming from my nose every time I bend over and
Oh,
things
nice.
like that. And then I just started noticing I had more energy and I was starting to feel more like myself, and that's not to say I didn't have bad days. And like I still, with the thyroid condition and
Yeah.
all of that, you still have these ups and
Right.
downs. Somewhere along the way, I was having a lot of double vision. I was like, something is not right. I ended up getting diagnosed with thyroid eye disease, which comes with
Yeah, with
Graves'
the
disease.
Graves.
Mhm.
And I got really scared. I'm like, am I going to get the bulging eyes? Am I going to get all these things? And then I had to tell myself, you know what? Like, you cannot worry about what's going to happen in the future. You have to live for right now and you have to do what you can
Mhm.
to help your body heal. And I just continued on doing the things that I should be doing. Somewhere along the line, I started seeing Jules and
Mhm.
hello,
She's the
amazing.
best. I know.
Yes.
Well, I love putting the moms with. So
Yeah.
Julianne Ingham is the nurse practitioner at Deeper Healing, and she's also a young mom.
Mm.
She's got a lot of passion
Yep.
for moms, pregnancy, fertility, children,
Mhm.
helping the kids. So it was great for you guys.
Yep.
Like, I'm sure, I bet you guys just,
Yeah, she's amazing. And she, when she would say to me, like, we need to do this or we need to do that. And she really took into account like where I was coming from. Cause I'm like,
yeah.
I'm a mom. Like I want to make sure I'm doing this or that for my body. And I do want to have more kids one day. And that was the other thing, I thought we would never be able to have a second child. We've always said, my husband and I've always said, we want like, 2 or 3 kids. And I was like, I don't think it's going to happen for me. I thought, this with this autoimmune disorder, even though I was getting better, I still, would have these like episodes
Mhm.
at times, especially when I wasn't doing all the things that I was supposed to be doing.
It is
you
hard
slack off a little bit.
when you're feeling good, you're like, I'm good, right?
Yes,
Yeah, I know.
exactly. And so,
Everybody
I
does
have
that.
my moments and then, Dr. B was like, when's the last time you were in here? I'm like, yeah, have you been taking such and such and such? I'm like, no, but it was, my daughter was she was like 6 years old, so this was just like,
Yeah.
2 years ago. And I'm like, I told Jules, I remember telling her because she was doing some routine checks on my thyroid levels and different things like that. And I was like, I really would love to have like another kid one day. Like, is that ever going to happen for me? Like, and she did some blood work and she was like, well, this looks great and this looks great. And, she's looking at all these different things. She's like, I don't see any reason why that cannot happen for you. She's like, yeah, there's stuff we need to work on. There's things that we need to do here. And I'm like, okay. I do have to say, before that, I had an issue with my liver before this situation happened. Okay. I had some blood work done and Jules called me on the phone and she's like, are you jaundice? Are your eyes yellowing? Is this happening? Is that happening? I'm like,
Oh, wow.
whoa. I'm like, what are you talking about? And I was seeing like these little brown spots on my feet, which I thought were really weird. They just popped up out of nowhere. And she's like, based on this blood work, like your liver enzymes are super high. I don't know what, I
Huh.
can't remember everything that caused that or whatever. But my gallbladder numbers, and I started learning, like now when I look at blood work, I'm like, I know what that ALT means. I know what that AST, alkaline phosphate, whatever that stuff is. So she was like, we need to get you in here because your numbers are like through the roof. I think your like liver, like your ALT is supposed to be between like 0 and 40 or like something
Yeah.
like that. Mine was like 700. Okay. It was insane. And so they're like, okay, this is what you're going to do. Like, here's this castor oil pack, taught me how to use it. I'm
Mhm.
like, oh, I've heard of people doing
Yeah.
this. Oh my gosh. Okay. And I learned about how that can really detox your liver and all these things. And, of course, family and friends thought I was nuts. They're like, you got to go to a real doctor. Like, what do you mean? Your
Just
liver
let them.
enzymes are, whatever. What are you talking about? A castor oil pack you're going to put on your, and let me tell you, the next time they did my blood work, it had dropped like in half. And then the next time they did it, totally back to normal.
I still
And
do.
no surgery,
I love
no,
it.
like,
I
no,
love castor oil. I still
Yeah.
do it all the time.
Oh my gosh, me
Yeah,
too.
me
I
too.
just do it as
If
maintenance.
I feel like bloated, oh my gosh, I do that. And the next morning, honey, it's all comes
isn't-
good to go.
you feel
You
like
lose 10
skinny
pounds.
girl. Skinny girl today.
That and add an in 'em.
Even
Yeah,
my
I'm
daughter,
telling you.
Right?
even my
It's
own,
like magic.
or even that
Yeah.
and Juvent.
Yeah.
Yep.
But people think we're
Yeah.
a little.
Yeah.
So it's just amazing that there's these things that have come up along the way. And I'm sure there's more that I can't even remember, but all this stuff. And it's like, they just always know what to do. They're right there.
Yes.
Like, we can
Yeah.
help you. We're right here. We know what to do. And yeah, so fast forward to where I'm, having this conversation with her and I'm saying, I just really, it's been like 6 years. My husband and I have done nothing to prevent us from getting pregnant. Like, why have I not gotten pregnant? I guess I'm just never going to be able to have more kids, She's like, no, you're like, everything's looking great, And it was funny because one of my friends at work said, I had this dream that you were pregnant last night. And I was like, and I was like, oh yeah, like there's hope, I guess. I am not kidding you. This was like 2 weeks later. Okay. From my conversation with my friend at work and from my conversation with Jules. I'm not kidding you. 2 weeks later, I'm like a little bit sore. That was my first symptom the last time. And I'm like,
oh my
yeah,
God.
I'm telling my husband and he's like, yeah, right. And I was like, you need to get a pregnancy test on the way home from work. Like, I think I was supposed to get my period like last week. I had stopped like tracking it
Yeah,
because
yeah.
I just wasn't getting pregnant anyways, whatever. So I wasn't tracking it or anything. And I was like, please just get one. And I was like, don't get those cheap kind. Okay. Get the good
Yeah.
stuff. Like, I'm telling them to get, I'm like, get multiple boxes because I'm peeing on
Yeah.
more than one
Oh
stick,
my
honey. Okay.
gosh,
And
this
he's
is
like,
awesome.
okay. So I pee on this stick. And when I tell you I had the shock of my life, I was pregnant.
Wow.
And I was like, no, I peed on another stick. Pregnant. I'm like,
oh my gosh.
I
This is
can't.
so
I was like, this
fun.
is insane. So I did the same thing for my husband that I did with the first pregnancy. I wrapped it up in a little, I don't know, tissue paper or whatever. And I put it in his man cave. I had the camera going and I'm like, hey, open that up. He opens it and he goes, what? He's shocked, like, it's just as me. And he's like, what? So I called my OBGYN. I think it was like the next day or something. And I talked to whoever answered the phone. And I'm like, I don't think I am, but I do need to make an appointment just to make sure and all this stuff. Right. And so I was like, I don't think I am. They're like, well, tell me, what happened? I'm like, well, by this time I had peed on 4 sticks. Okay. And they all said pregnant. And she said, ma'am, if you peed on 4 sticks and they all say pregnant, you're pregnant.
Yes.
Congratulations.
Yes,
And
that's
I was
right.
like, what? And, we went to that appointment whenever at the 8-week mark. And
I know they make you wait so
yes,
long.
I just want to
See it on the ultrasound.
and so sure enough, there was a heartbeat and I
Yeah.
was pregnant.
Oh.
I could not believe it. And I really feel like if it was not for all of those treatments that I was going through to heal my body and detox my body,
Yeah.
you hear so many stories. Like my heart goes out to these women that want to be a mom because I've always wanted to be a mom. And if I could not have that come to fruition, I just would be an empty soul. I mean, they're my world, And when I see these moms that they want to get pregnant and they're trying to go through IVF and they're trying to do all these things.
It's an epidemic. This
Yes.
fertility thing is an
Yes.
epidemic. And
Yep.
Dr. B says it all the time. We're not talking about the thing that needs to be talked about, which is getting the toxins out of
Yes.
the body.
Yes.
We start pushing in, trying to force something to happen.
right.
But he's like, actually, the body is protecting
Yeah.
the next generation.
Right.
We need to be cleaning up the bodies. Like
Mhm.
I'm working with my daughter right now. My daughter is high heavy metals because from me,
right.
and she's 22 years old. I'm like, you are not having a kid until all this stuff is cleaned
Right.
up.
Yep.
No one even knows to look for these
Exactly.
things. Like,
Yeah.
I
And
just
that's what
want
I
to say
wish
that
those
out
doctors
loud.
would know to tell those women to
Yes.
do, because if they detox their body, I mean, their chances
body
of
is
getting
going-
pregnant could
yes.
significantly go up.
So
Yeah.
many stories,
I mean,
so many fertility stories we
Yeah.
have like that, where they
Yep.
just get really cleaned up
Yeah.
and things start to work the way they're
Yeah.
supposed to.
And I feel like I was really blessed to get pregnant with my first one. I mean, it took us 6 months, which I know is nothing compared to what some women go through. But then with the second one, it took us 6 years.
Yeah.
6 years. Where, I mean, at some point we weren't actively like tracking and stuff, but we also weren't doing anything to prevent it. Like you would think after 6 years, you would have some kind of oopsie, right? But I told my family, I'm like, this is the immaculate conception over here. Like,
Yeah.
I don't even know. But
You're like, did we even?
I'm like, when did we? So, especially when you have a husband who's a police officer and works night shift and you're not even in the bed at the same time half the time. I was like,
Yeah.
So
Yeah.
this happy part of the story takes a very wild turn.
yes, it does.
So we have, first of all, I just want to say before we go into the craziness of what's coming next, your daughters are little clones of each other.
Yeah.
They are perfect and
Aren't
so
they?
beautiful. And what a gift
Thank
and what a
you.
blessing.
Love them.
I love your family. I
Oh,
feel like
I
feel
love
like
you.
our whole place is like, we love
Oh,
this. We
mhm.
have because we've been watching you guys the whole way through. And
Oh.
actually, your daughter's in our Deeper Healing commercial.
I know.
And that was just a random. That was
Oh, that's
there
what she
was-
does every time.
there
It's
was
so
a
natural.
moment-
She runs up to you and hugs
she
you every
runs,
time.
she runs up.
Oh my gosh.
And they
Yeah.
just happened to be filming when she ran up and hugged me.
Yeah.
And
That
ended
is
up in the-
adorable.
ended up in the commercial. So that's pretty
amazing.
cool.
And it's going to
Um,
be in the documentary coming up, right?
No,
I
that
thought
was
I
for
saw
a
it in the preview.
Oh, really?
yeah.
Well, maybe then.
Huh?
Maybe I'm wrong. We have a documentary. We have a
yay.
Hope for Deeper Healing coming out.
Exciting.
No, I was thinking of the total body burden.
Yeah.
That's
Yeah.
where I thought I saw
Oh,
her in
okay.
it.
Yeah.
Maybe it's in there. I
There's a
didn't know
couple
that.
things coming
Oh,
out.
yeah,
I'm
lots
excited.
of big
Let's
things
do it
happening.
now.
So, okay. So I'm going to let you tell this part of the story. You have your baby
Mhm.
number 2. Everything's great.
Yep. Well, here's the thing. When I was pregnant with baby number 2, my little Selena, I think God gave me that baby to save my life. She gave me that baby to save my life. She really, I mean, he gave me that baby to save my life. She really has. I mean, before I got pregnant with her, I knew that I had an enlarged ovary. And they had told me, it's a little bit enlarged, but weren't concerned about it. They were doing the typical, and I love my OBGYN. I've been going to her for over a decade. She's amazing. And she was doing all the things, they were testing me for ovarian cancer. They did the C125. It was negative, although I know that sometimes it has false negatives, false positives, and all of that. But there was no signs of like anything to be concerned about. They said it just looks a little enlarged. But then they were tracking it and it had grown like a little bit, but just not a lot. And it just didn't have a real concerning look. So when I got pregnant with baby number 2, I had to see a high risk doctor again because, they consider you old if you're like over 35 or whatever, and you have to go to high risk. And I had a thyroid condition and all the things. So I was seeing my regular OBGYN, and then I was seeing a high risk doctor. And, usually when you have like these ultrasound techs that are doing your ultrasounds for you while you're pregnant, I'm pretty sure they're trained to not really make a face or say anything.
I can only imagine. I
But
always
this
think
one,
that.
she says to me, "Oh, what's that?" I'm like, "Oh my God." I'm over here like, "What? Is something wrong with my baby?" I'm like totally
Oh my gosh.
panicking. And then I was
Are
like,
there two?
yeah, I was
That would
like,
be the
"Whoa."
first thing.
And then I thought she was going to tell me that my child had polydactyly because Rosalind had polydactyly.
Oh,
So
okay.
my husband was born with 12 fingers. His mom was born with 12 fingers. So was his grandma. So it's a
Thing.
yeah. So my first daughter had that. And I'm like, maybe they're seeing that again or something, And she's like, well, I'm seeing like a you know, something here. And I said, oh, is that my ovary? Like, cause I know I have a slightly enlarged ovary. She goes, yeah, this is really big. And I'm like, okay. And so I'm like panicking. I'm thinking, why is she saying all this to me? And of course I can't ask her any questions. She doesn't know. I mean, she's
Mm-mm.
the ultrasound tech. So now I'm totally terrified. And of course my husband comes to me with pretty much, he comes to every appointment. But this one, he was not able to come. And I had my older daughter with me. And I am just like in tears. The doctor comes in and he goes, we're concerned about this. This ovary is like double the size it should be. We are concerned. I told him, that my OBGYN, my primary one, had known about it. This is what we've done. This is what she's tested for, blah, blah, blah. Okay. So he's like, I think we need to refer you to an oncologist for gynecology. And in that moment, my heart sunk. And I'm thinking, I am pregnant with this miracle baby. And you're telling me that I need to go see an oncologist? I'm like, my gosh, this what? And he kept referring to it as a mass. And I'm like, is there a mass on the ovary, or are you referring to the ovary when you say mass? Like, I'm trying to understand what he's saying to me. And he's like, well, it doesn't look like there's a mass on it. It just, it's a mass itself, I don't know. And then he was talking about they're looking for, how much vascular blood
Yeah.
flow and all this kind of stuff. And he's talking to me about that. And I'm thinking, oh my gosh. Right away, I called my.
How far are you? At
So
this point?
I'm probably in my second trimester, I feel like, beginning of the second trimester.
Okay.
It's not early on, but it's not super late. And I call my OBGYN right away and I'm like, oh, now they're referring me here. And she's like, okay, let's not panic, and she's amazing. So I started seeing this oncologist for gynecology, and she started looking at my tests, and they're doing more ultrasounds, more tests, all these things. And she's not concerned. She's like, sometimes she's like, it does look like, oh, that she sends me for an MRI. And I'm like, you can get an MRI when you're pregnant? I was like, what? So they sent me in for an MRI. I got one. Like, there's a partial torsion that could, sometimes the blood flow like increases, decreases. It goes back and forth. Maybe that's causing it to be enlarged, but I just don't see the things that I would look for it to be something concerning,
Okay.
I'm like, okay. But in my mind, I was terrified my entire pregnancy. I
Yeah.
could not stop thinking about that. And the high risk doctor said, this is something you need to get this removed. And we can't do this at the stage you are in your pregnancy. And I'm like, well, obviously not. Even if they wanted to, I'd be like, no, no. So they're like, you need to have this removed pretty soon after you deliver. So along the way, I'm talking with my OBGYN about what the plan is going to be. I delivered vaginally, naturally with my first daughter, and that was the plan. Now, my first daughter had a shoulder dystocia issue where her shoulder kind of got stuck coming out of the birth canal. And so this baby was measuring bigger. And so they were concerned about that happening
Mhm.
again, because that was very scary. And I know it can get very scary. She was kind of warning me, like, we may have to consider a C-section. I know you don't want that, but let's just think about it. I also knew I needed to get this ovary removed, and I was having a lot of anxiety about having a surgery after having a baby. Like, I have a newborn at home. You want me to go get under anesthesia and have a surgery? Like, I've never had a surgery in my
Was this
life. So that's what my OBGYN was suggesting was, if we do, and she's like, I'm not going to do a C-section just to take out the ovary. If we need to do it for the baby, then we should do them
Yeah.
simultaneously,
Okay.
which I appreciate
Yeah.
because she's not just like
Yeah.
willy nilly, like, let's do a C-section.
Mhm.
So she's like, and we got to that point where the baby was measuring bigger and we're like, okay, I think we just need to do that. And then I really thought about it and I'm like, that's better because I don't have to be put to sleep. I was starting to have a lot of anxiety about having a surgery and being put to
Mhm.
sleep. I've never had a surgery before. I think some people just think it's like no big deal, but for me it was. And so those days leading up to having that baby, I was just terrified thinking about having this C-section. I didn't know what it was going to be like. I'm trying to ask all my friends, like, what did you experience? So I have the C-section and little Selena comes into the world, which is so amazing. And my OBGYN is doing this procedure. She's taking the ovary out. And, before we go in there for the C-section, she asks, her patients always like, what kind of music do you want playing? And I said,
Mhm.
Christian music. And she's a believer too. So she's like, oh, of course. And this song came on by Katie Nicole, and she was like a newer artist, I think. And it's called I Pray for Your Healing. And in the moment that my doctor said she was taking that ovary out, she said she's taking it out, that song came on, and it was just like a playlist
Yeah.
going, like, and I didn't tell them this song specifically or anything like that. And that came on. And I remember laying there, the sheets up there. My husband's holding the baby, or the baby was, I think they had put her on my chest or whatever. And tears are just rolling down my face.
Mm.
And in that moment, I was like, God's got me. Like, I know I'm going to be okay. I know I'm going to be okay. It's it's gonna be fine somehow or another, because that song was really getting me through the last couple of years of being, like, scared about
Mm.
what was going on with that ovary. And, I go home, I'm breastfeeding my beautiful baby. I'm super happy to just be in, like, a better space and a better
On the
headspace.
other side.
And
Yeah.
I'm like, "Okay, I'm gonna do this. I'm gonna breastfeed for the first year." I was so excited about it. I'm like, "I know it's gonna be hard, but I'm doing better this time." And, all the while, I'm waiting for these results because they said, "We're gonna send this ovary to pathology." And 8 days later, I will never forget that day. My daughter was born on January 10th, and on January 18th, my daughter was at school. My husband had taken her. I'm on maternity leave, and my husband and I are sitting on the couch in our living room, and I'm holding my little baby in my arms. And here comes that phone call from my OBGYN. And she says, Angela, it is cancer. And that was one of the worst days of my life. This is the hardest days. I mean, talk about postpartum depression. Hello. So here I am holding an 8-day-old baby in my arms, and I'm like, there's no way. Like, my God, this is not happening. Who gets diagnosed with cancer 8 days after having a baby? Like, this is my little miracle baby. And I couldn't believe it. I couldn't believe it. And my husband is sitting next to me and he's very quiet. He's not saying anything. And my OBGYN, she's just talking on the phone and assuring me, you're going to be okay. We're going to get through this. I'm praying for you. I'm going to set you up with this oncologist, blah, 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 all the things, right? She's going to contact you and get you in right away. I'm like, okay. And I'm like, I mean, what is it? And they really couldn't tell me exactly what kind of cancer it was, but they did. I think in that moment, she did tell me it was lymphoma. I had a little bit of hope because I had done a lot of research on ovarian cancer, and that is some scary stuff when you read about ovarian cancer. It's one of the harder cancers to cure. And that was what was in my mind the entire time, like hoping it's not that. And when I hear it's lymphoma, I'm like, okay, I kind of know a little bit about that, but not really. They don't know what kind. So now I'm waiting. I'm waiting for the oncologist to call me. I'm waiting to get this appointment to figure out what I'm going to do. My mother-in-law was supposed to come over that day just to help with the baby. She had been back and forth and stuff like that because they live an hour away. And they were already on the way because they were supposed to come that day. And my husband was upstairs in our daughter's bedroom, and he was on his knees, and he was talking to his mom on the phone. And he said, "Mom, Angela has cancer." And she just started screaming, and he is like crying. I've never seen my husband cry like that. He's very strong. And in that moment, I stopped crying because I felt like I had to be strong for him. I'm like, he's scared right now because his brother has passed from cancer. His dad has passed from cancer. And now I know he's scared. He's scared to lose his wife, you know? And so I was like, I gotta woman up. Like, I gotta somehow pretend like I'm okay because I don't want him to think that I'm going down without a fight because these are my kids and I'm going to raise my kids. Nobody else is going to raise my children. No one can love them and take care of them like I can. So I knew I had to do something. And right away, I got on the phone and I called Dr. B. And whoever answered the phone, I was like, I need Dr. B right now. I need him to call me back today. I just got this diagnosis. I need help. I need him to tell me what to do. I need him to call me today. And I'm telling you, within minutes, my phone was ringing. And there he is on the other end. And I just thank God for him because his voice was so calm. And he's like, hold on a second. Let's just hold the phone. You're going to get in here and we're going to talk about this. Don't do anything. Like, don't make any rash decisions. Like, we're going to talk about this and figure this out. I'm like, okay.
I remember this so clearly.
I'm like, all right. And so while I was dealing with all of this, my first daughter had the same thing. She had high bilirubin levels. What is it called? Yeah, she had jaundice. What is it called when like you have a different blood type than your child?
The type O positive.
Yes,
Usually.
like my kids and
the
myself.
RH factor.
Yeah, there's like some kind of, I don't know, thing that happens that can cause the bilirubin to be out of control,
Yeah.
jaundice and all that. And with my first daughter, we were in the hospital for a week with that. And I was nervous that this was going to happen with her, but they did let us go home. We had to have the blanket and all the blue light and all that stuff, but we had to go every day and get her blood taken and get her pricked and all this stuff. So here I am taking my daughter to these appointments, and my husband's driving us around every day because, hello, I just had a C-section. So I had a major surgery. Right. Okay.
Nursing,
and so we're going, yeah,
Oh.
I'm going to the breastfeeding clinic center, where they help
Yeah.
you and all
Yeah.
that kind of stuff. I'm going there. We're going to these appointments for her. I'm worrying about her bilirubin levels. Now I'm going to an oncologist. I'm like, this is crazy town. Like, what is happening right now? I just want to have another baby, And so here's my husband, so strong the whole time. I mean, he is just like, he's driving that car. He's taking us where we need to go. He's right there with me. I mean, amazing. And when I got to Dr. B's office and I went over with him where I was at, what was going on, he's like, well, we need all the facts first. Like, the first thing the oncologist is probably going to do is have you do a PET scan, and they're going to do this and they're going to do that. And he's like, let's get this information. Like, we need to know what we're dealing with. And so I met with the oncologist. She did tell me it was diffuse large B-cell lymphoma, non-Hodgkin's lymphoma, apparently a very aggressive cancer. That's scary when you hear you have an aggressive cancer. I'm like, hold up. I just had a baby. And they're talking about, the chemo treatments, and you're going to need to do this, and we're going to need to start right away. This is very aggressive. And I'm like, hold up. I'm like, and they're telling me you're not going to be able to breastfeed. You're not going to be, all the things when you have chemo and everything. I'm like, no, I am breastfeeding this baby for a year. I don't care what anybody says. I'm breastfeeding this baby. And I'm just thinking, I don't want to be super sick. One of the first things that I told my OBGYN when she called me and told me I had cancer that day is I said, what am I going to do? Because I can't do chemo. That is going to kill me. I cannot do chemo. It came out of my mouth just like that. And I was terrified thinking about doing chemo. And I understand standard protocol, and they know what they know. That's the treatment that they do, So I went and got this PET scan, so terrified. I was so scared getting this scan. I'm like, is this what my life is going to be like? Am I going to be in the hospital every day? Am I not going to be able to see my kids? That is what I was so scared of. And when they told me, even just to get that scan, it gives you radiation and all this stuff. And I'm thinking, oh God, but I have to get it because I need to see where I'm at, but you can't be around your kids for like 18 hours afterwards. And I'm like, what do you mean? That was torture for me. That was torture. I'm the one that puts my kids to bed at night. I'm the one that reads them stories and even when my husband is there to do it, I'm there too because I'm just that mom, and I'm not saying I'm better than other people or whatever, but I'm just that mom. When I'm off work, my kids are with me. That's just how I roll. And I was not able to put her to bed that night. And that really broke me. And it was hard to explain to my child, like, she's 6 or 7 or 6 at the time, whatever, 7, I don't know. It's hard to explain to her why I couldn't be around her, why I had to come home and quarantine and hang out in my bedroom and get on the video chat with her and all this. And she cried and, it was very scary. And of course, my mom had came in town. She was there within, a matter of 2 weeks after this diagnosis and all of that. And, I had a lot of support. And honestly, it was just scary. It was scary, like waiting on these results, figuring it out. But my oncologist was really great. She knew where I was at and I was having so much anxiety. I was just had a baby. She was like, I'm going to meet with you that same day that you get that PET scan. Schedule an appointment. I'm going to meet with you that same day. And she did. She met with me. She went over the results and she was like, well, she's like, the only thing that's showing up is this, your hips are lighting up a little bit, but I do expect that you just had a baby. I expect some things to light up there. There's inflammation. You just had a C-section, all the stuff, but it's enough for us to cause concern that we need to do a bone marrow biopsy. I'm like, what the heck is that?
Oh, geez.
And so I talked to Dr. B and he's like, you know what? Go ahead and get that bone marrow biopsy. Like, let's just, and obviously he was never telling me what to do. He was never like, do this, don't do this. He was just another person that I could, just
Get a solid
get
opinion
a solid
from.
opinion from.
Yeah,
Exactly.
he's so good for that.
Because of course, when you talk to your family and friends, are like, whatever that oncologist tells you to do, you need to do it,
I know.
but they don't know what I know.
Right.
And they haven't been walking in my shoes for the
That's
last
right.
decade. And they haven't been living this holistic lifestyle that I've been trying to live and
That's right.
don't really understand the things that I understand. And I was like, you know what? Okay, like I'm going to get this bone. I have to know. I'm like, oh my gosh, well, what if it's in my bones? And I talked to my chiropractor and they're so amazing. They were praying for me and they're like, we don't expect it to be there. Like, and even the oncologist said that she didn't expect it. She's like, because if it's in your bones, we would see it lighting up a lot of other places. Like, and my oncologist or my chiropractor said to me, that PET scan would have lit up like a Christmas tree if it was already in your bones. Let's just pray on it. That's the worst thing about a cancer diagnosis, honestly, is the waiting game.
I was
of
just
test
gonna say the
results
waiting
and the
game.
anxiety of that will
Yeah.
kill you. The fear and the anxiety will kill you. And I wear this ring every day for a reason. I mean, it says faith over fear. And I kept
Mhm.
saying that to myself
That's right.
over fear every time I was scared, every time I had anxiety,
Mm.
every
Mm.
time I was mad. I would play my Christian music and I would listen to that and that would get me through. So they're like, we want you to do this chemo. You need to start in a couple weeks. And Dr. B's like, and this is the same thing I had been saying to myself. And this is the same thing even a few family and friends said to me. Why do they want you to do chemo if nothing is showing up on your PET scan or your bone marrow biopsy? What are you doing chemo for? They've already taken out the ovary where the cancer was.
Yeah.
What are you doing the chemo for? And I said, well, that's what I want to know. So I sat and asked, and it's standard protocol. And I get it. I get it. I understand how their world works, and it is an aggressive cancer. And I understand how they're small cancer cells and they can grow. But I also am smart enough to know that everyone has cancer in their body. You do, everybody does. Everybody watching this does. They're just abnormal cells in your body.
That's right.
And if you feed them, they're going to grow. And if you know how to detox your body, then you can get rid of them. I do know that I have an autoimmune disorder. And I do know that I have Epstein-Barr virus in my system. And I was still in the process of doing more UVB for that. But I realized there is a link between that and lymphoma types of cancer. And
That's
even the
right.
oncologist confirmed that for me. And
With Epstein-Barr.
yes,
Yes.
when you have Epstein-Barr virus, those kind of chronic viruses in your system, you are more at risk for having a lymphoma type of cancer because it's your lymphatic system, it's part of your immune system, all of that. And so it took me, some days. I was thinking on it, and it was a very hard decision to make. And every single day I worry if I made the right decision, but I chose not to do chemo. I said, no, I'm not doing that. I'm going to breastfeed my baby. I'm going to go to deeper healing. I'm going to do some treatments that can boost my immune system because I know the chemo is going to wreck my immune system. And I already have an issue with my immune system because I have Graves' disease. I have Epstein-Barr virus. All these things. And I'm like, I can't afford for my immune system to be worse than it is. And
That's
I
right.
just, all these like stories were just popping up on my, social media pages about people that were like having chemo and experiencing other things. And I sat with a different oncologist because I wanted a second opinion. And so I went downtown to one of the top lymphoma specialists at MUSC, and I sat with him and I asked him some hard questions. And I think he was kind of like, whoa, who's this girl? She knows some stuff. And I said, I just recently read an article from the American Cancer Society, and it listed all of the reasons why you might have a reoccurrence of cancer. And one of the things that was listed was chemotherapy. Is that true that chemo can cause cancer? I know that's true, but I wanted to see if he was going to tell me it was true.
Yeah.
And he looked me in my eye and he said, yeah, it can. And I'm like, so you want me to do chemo for a cancer I don't have in my body anymore so that I could get another cancer? No, thank you. No, thanks. And I can't predict the future. I don't know what God has in store for me. I can't say that I would never do chemo. I feel like I was blessed. I'm in a different situation than other people. And I don't knock anybody that has had chemo. Again, if I was in a different situation where I was sitting here and they're, telling me different things, I may have made that decision. And I'm not saying that, and I pray to God, I don't have to ever make that decision. But I did not want to be pushed into doing that because it's standard protocol. And I said, I am not another page in your medical textbook, and I know better. So I'm going to do what I can.
Discernment. Yes.
Yeah. And I think a lot of people just feel like they don't have any other options.
100%. You're so right about that.
Yeah. And I've met a lot of people at Deeper Healing that I was sitting alongside that have had cancer that chose to not have chemo, but also ones that did do chemo and still were coming to Deeper Healing.
We see all of it.
And Dr. B and Jewel, they would never tell someone not to do that.
That's right.
If people need that, they need that. It really depends on what kind of cancer you have, what stage it is. Like but know that chemo can make you very sick and it's going to wreck your immune system. But there are things that you can do, like fasting while you're getting that chemo, that can make it more effective. I learned that. And I did ask that oncologist. He goes, yes, I've read that. And I think that can be effective, but also just the other treatments that you can get at Deeper Healing that can boost your immune system. That is so important even if you choose to go through chemotherapy, because there's so much that you're going through and you're putting on your body. And from the stories that I've heard from people that I'm sitting right next to, getting treatments, they're like, yeah, I'm going through chemo, but I've noticed a huge difference in the way I feel compared to when I wasn't coming here and getting chemo, or from other people that I know that have had chemo and weren't getting these treatments.
We have it all over. I see it all over the place in there.
Yeah.
People doing, I think the most powerful thing, if I can add to this exact conversation, people are in all different stages and, with whether they're, I call it straddling the two worlds, or only in one or only in the other. But I think they're real. And we have a lot of amazing supportive things for either direction. But the thing that I think that we're amazing at, Dr. B says this: If cancer is nothing but a rogue cell, and everyone has rogue cells, cancer is a problem when they're multiplying faster than you can get rid of them, right? The higher level question is this: why is my body an environment that cancer is thriving in now?
Yep.
When it was not before.
Yep.
So we know what those reasons are.
Exactly.
So that, it could be high chemical levels. It could be mycotoxin illness. It could be
And I think there's so many
loads,
people too that were surprised, like that I got a cancer diagnosis because they know the way I live my life. And, even my own sister, she's like, I am so shocked. You were the last person that I would expect to get this diagnosis. And what I say to people is, even though I've been living my life as holistically as I can for the last I don't know, probably 8 years or so. It does not erase like necessarily what has happened to me over my entire life. Like there were
Mhm.
still things that were going on before that. I mean,
Or what was there when you were born?
right,
I
exactly.
have
So
stuff
many
in my body
things.
that I
Yeah.
know was there before I would like from
Exactly.
birth.
So that's why it's really important to keep on top of your health and
Yes.
to really be your own advocate and
Yes.
push for other options and don't just sit across from that doctor in the white coat that's like surgery and pills. Those are your only options because that's not true. It's not true.
Even traditional cancer treatments, one thing I've said to a lot, because I've ended up doing a lot of calls with the people that call in. If I just finished my chemo radiation, Danielle, you're in remission. We want to see you again in 6 months for a
Mhm.
scan. Do you know what I do for that 6 months? I bite my nails. I freak out
Mhm.
because I got 6 months to wait till my
Mhm.
next scan.
Mhm. I was there. I did that.
Do you know what that does? That causes disease.
Yep. Mhm.
Being in chronic fear
Yep.
causes disease.
Yep.
That's
Yep.
why your faith over fear is a very
Mhm.
powerful tool that you were using,
Yep.
whether you realized it or not.
Yep.
You were like pulling your fear down
Mhm.
mentally. If people were empowered to know, how do I change the environment that allowed cancer to even get here in the first place?
Right.
These are the conversations that we should be
Yep.
having.
Because that ovary was enlarged for 4 years before I found out it had cancer. That I had known
It
about
was
that
a
for
slow
several
and
years,
truthfully,
Mhm.
you know?
your pregnancy could have ramped it up.
Yeah.
You
And
know what
that's
I
what they
mean?
said too. It
Yeah.
could grow
Because
like within pregnancy.
uh-huh.
Yeah, it's just crazy because, and that's why I say I feel like God gave me this baby to save my life because otherwise that ovary would not have been looked at again.
Right.
Like
Yeah.
there was nothing, even the oncologist that's for gynecology, she was shocked to find out that it was cancer. She was the one that was going to do the surgery, but then because we did the C-section, my regular OBGYN did it. So
Okay.
she called her and told her, and she said that she was shocked to
Wow.
find that out because it did not look like I think because they're looking for ovarian cancer,
Yeah.
obviously,
Right.
Yeah.
And I mean, I'm a believer. So I feel like God could have turned that around for me. It could have been ovarian cancer. And he was like, nope, it's going to be lymphoma instead. And we're going to cure this and you're going to be fine,
Mhm.
And I started learning about the lymphatic system and how to do drainage massages and getting on my
Yes.
rebounder and all these things that are good for your lymphatic
Yes,
system.
queen.
I'm right.
This is so
I was just, doing all this research and there's just so many amazing things that you can do to support your body. And I knew I had to be in a good mindset. And my best friend kept saying this to me. And she's like, you know what? You have to get your mind right
Yep.
because that stress and all that, like that's not going to help. It's going to make it worse. And she has that same understanding that you guys have as far as, how that really can affect your chronic illness. And I tend to be a very stressed out person naturally, been like that my whole life, but I manage it pretty well. A lot of people don't realize when I'm like super stressed out,
No.
but I told myself, I'm going to do everything I can to be in a good headspace. And even when I would go to the oncologist and I would feel some kind of way or just feel nervous about, am I making the right decision or talk to a family member or friend that would put me down in the dumps because now they're like,
Yeah,
what do you mean
what are
you're
you
not doing the
thinking?
chemo? What are you thinking? People tell
Like
me I'm
shaming
crazy and all
you.
this stuff. Yes. And so it would put me back,
know.
emotionally. But every single time I walked through those doors at Deeper Healing, I was like, I have those cheerleaders right there.
Yeah.
I
We
just
all
felt
love you so much. Love you
full,
so
and
much,
here I
your whole
am with this
family.
little baby getting these
know.
different
Aw.
treatments
We
and they
would
would
fight
hold
for
her,
the
they would go
baby.
change her for me. They're
Yeah.
doing all these things that I was so grateful. I'm
We
like,
have a nursery now
I was
because I'm
there
just
like,
kidding.
I was there like, give me
Right.
that baby.
Yeah.
Give me that
like,
baby.
you need to have a little daycare center running for
Yeah.
you.
We
Just
love
Can you
it.
imagine the
Oh
space
my
next
God.
door is for rent?
Yes.
We'll have little deeper healing babies
Yeah.
running
No,
around.
I just have to say out loud, I feel very emotional. You are an incredible person.
Thank
You're
you.
incredible. And you've had quite a freaking journey.
Yeah, I think this is, and I've said we've done I don't even know how many podcasts now. This story
It's unbelievable.
is the first time I've cried.
I know.
And I was like, where are the tissues?
I
What's
know,
happening? We need
literally,
tissues on the set
literally.
now.
Especially as moms too,
yeah.
knowing that
Mhm.
you're a young
just
mom
imagining
and, yeah.
or hearing I mean, the rawness, and you're a really good storyteller. I just felt it, and you're really strong.
Yeah, you are.
And like, I like want to hug you right now, but I don't want to mess up this. But it's like, I mean, so many women out there, if anybody's listening, the mindset part and like what she's done. And now you did have, and luckily this is like what this podcast is all about, because there are cheerleaders out there for people. There are other solutions. And that's what we want to expose, because we sit here at Deeper Healing and hear all the conversations from all the different patients that are there, how they did turn their life around, how there is hope, how you don't have to stay stuck on this side, in this fearful side of medicine, thinking you have to take a bunch of toxins and chemicals and make yourself sicker. Yeah. Is that an option?
Yeah.
You can do that, but like to hear you, I don't know, just hear the whole story from the very beginning.
And just
it's so
empowering. It's
And
empowering.
I feel like, you know, God put Deeper Healing, put my best friend who's taught me so much about holistic living, certain people in my life for this road leading up to this cancer diagnosis, because otherwise I wouldn't have made the decision I did. You know, I've learned so much, and I feel like I wouldn't have felt confident enough to make that decision not to do chemotherapy.
They were the messengers on your path.
Oh, yeah.
I mean,
100%.
Yeah. And
You
then
can
I
always
also
see it
feel like
backwards.
the way that I have been living my life over the last several years, and I don't know this to be 100% true, but I feel it in my soul, that maybe that's what helped for this not to grow and get out of hand or spread somewhere else because of what I'm doing. You know?
Yeah, 100%.
Because
all
if
the
I
things
wasn't
that you were
living
doing,
this lifestyle that I've been living and learned so much about, you know, taking care of my body and detoxing and all of this stuff, who knows where I would be?
yeah, no,
Who
if you
knows
were
where I would
drinking a
be?
bunch of Mountain Dew,
Right.
eating a bunch of
Right.
like cereal, drinking a
Right.
bunch of just, you know, milk with hormones and antibiotics, and it's like it's all the things.
Yep.
But if like you would have created that environment, that would have feed and fueled that cancer so
Exactly.
much faster. It would have taken you down and out. You
Yeah.
wouldn't have had the knowledge. You do the chemo, and
And I mean,
it
I was
probably wouldn't have turned out
terrified
very good.
because they, you know, kept telling me it's very aggressive, and I've researched it obviously. And so I'm terrified. And I knew I needed to get another follow-up PET scan. And I told them like the day that I was supposed to start my first chemo treatment, I just was so nervous about, I was supposed to have an appointment with the doctor also. And I didn't want to go to my appointment with the doctor because I was afraid that I would be convinced. And now my oncologist is very sweet, and she's amazing and has never like tried to force me to do anything. But I just didn't know her well at the time. And so I'm scared. I'm like, is she going to try to talk me into doing the chemo? And so on purpose, I scheduled an appointment for Deeper Healing that day to get on my treatment.
So that you could get talked off the ledge.
And I literally, they called me while I was in the chair getting an IV. I'm not even kidding. And I was getting an IV, and I'm like, and they called me and they're like, oh, you know, you have this appointment and you didn't show up or whatever. And I said, well, I won't be there. Not coming. And I just said, I have some reservations about doing it, and I might consider it in the future. But right now, I don't see the reason to. I've had a bone marrow biopsy. I've had a PET scan. They were all free and clear. I'm just not going to do it, you know? And
You're doing great. How far out are we now? How old is the baby now?
You know, she's about 16 months, almost 17 months.
Okay.
So yeah, January was a year. I did have a recent PET scan, and I got that all clear.
My goodness.
Which is amazing, because I did have one 3 months later after my initial diagnosis. And then I had another one, I don't know when. Actually, no, I was supposed to have another one like 3 months later, but then I kind of put it off, and it was the holidays, and I was just scared. I didn't want to find out again around the holidays that like I had something. And you know, so I kind of put it off, and then finally went back to my oncologist, and I'm like, hey, I know I need a follow-up. I do need to make sure. And it's scary because I don't know.
I know.
I don't know what's going on in my body.
None of us do.
You know?
That's the reality.
So I keep telling myself, you got to keep doing what you need to do to keep your body healthy.
That's right.
And make the right decisions as much as you can. And no one's perfect. I'm not perfect, but I do what I can. And I am going to, you know, my oncologist, she was so happy for me. I mean, her and her nurse, they're like cheering for me. Like, we're so happy for you. You know, you got this free and clear PET scan and no evidence of disease and all that.
And nursed your baby just like you
yes,
said
I nursed my baby, you know.
Had this amazing,
I
this
I made it like
beautiful.
10 months, and then I was like, just so exhausted after that. I think 10 or 11 months. And I was like, woo, I'm so proud of myself.
But you have two healthy babies.
Yeah.
And everybody's doing great.
Yeah.
Awesome.
I want to add something. I want you to add something because you said it on the way in. The power of UVB ozone.
Yeah. Oh my gosh, it's amazing.
That is
Yeah.
that's
I
like my
had a
treatment.
lot of those last year, after my diagnosis, because with lymphoma and Epstein-Barr, and I knew the Epstein-Barr being in my system still, like I that can contribute to this. Like, so I was doing a lot of those anyways, but it's been a while since I had one, and I don't get sick as much as I used to, but I all of a sudden got sick, and usually I get it from the kids, but they hadn't really been sick. And all of a sudden, like Friday, I wake up and I'm like, I feel so horrible. I can barely swallow. My tonsils are swollen. I've got white stuff in the back of my throat. And I don't have any of the fever. It's not as bad as what, it has been in the past, but I did feel some fatigue, and I'm just like, gosh, my throat just is killing me. So I was like, I'm going to do all my things, my herbal teas, everything that I do at home. And I always tell people, like, I'm my kid's doctor. I'm my own doctor, because I make all my own little things. But anyway, I was like, well, I need to be sure. Like, is this strep? Is it, So I go to the Minute Clinic, and they do a swab, and they're like, no, it's not strep. And I'm like, okay, what is it? They're like, oh, it's just something viral. And I was like,
I know what
I bet this is a little bit of that
Little bit
EBV just kind of
EBV.
flaring up a little bit here, which again is nowhere near what it was before.
Yeah.
So of course, then I was like, well, this was stupid. I should have called Deeper Healing on Friday when they were open, so that I suffered all weekend. And then Monday morning still woke up really horrible. I mean, this was like the 4th day now where I'm like, I can't even barely eat. I was making my bone broth. I'm doing all the things. But I called, and of course they got me right in. They talked to Jules, and she needs to come in, get that EBV. And the next morning I woke up and I felt like a new person.
So
I was like,
she got a UVB ozone 35-minute treatment.
Yeah.
It's the ultimate, bash that virus,
Yes,
And,
it was amazing. I'm like, oh, if I would have gotten this done on Friday, I wouldn't have suffered all.
Gosh, so you felt great that night.
Well, yeah, I started feeling better later that day, and the next morning was a lot better. And then what's today? Wednesday?
Mm-hmm.
And then this morning I wake up and I'm like,
it's gone.
I did nothing.
It's funny. I did the same thing. I had something very similar. I guess it's gone around. I don't know. But I had it a couple weeks ago, and I've never done a high dose. I've only done standards.
Yeah.
And I was having all the things. And Dr. B's like, just go get a high dose. I'm like, really? He's like, yeah, just go get a high dose. I literally went bike riding that night.
Wow.
It was gone.
Mm-hmm.
Wow.
Yeah.
No, I haven't had
That
one yet.
was
Oh my
amazing.
gosh.
I've done everything but the UBD because I haven't had to. I haven't been, but I'm like,
yeah.
I could go on and on and on about a UVB ozone, but for anyone out there, it's amazing with Epstein-Barr or any other horrible virus and bacteria. And it's a blood IV treatment with ozone. And there is a connection. When Marty, my husband, had long chronic Epstein-Barr, 3 separate doctors, when we went through our 10 years of all the physicians, said, I don't know why you don't have cancer, to my husband, because he was so severe. And I truly know that not only did UBI ozone heal him, but it also, it didn't just heal him. It took him back to who he was.
Yeah.
It was like hitting the reset.
Mm-hmm.
So I could go on and on and on about that treatment, but hearing you say that, and I had the same experience 2 weeks ago, just how immediate it was.
Yeah.
It's not always like that, especially for someone who's very sick and chronic, but you were just having a little
Yeah, I think I was just having a little flare up, or just whatever it was.
Just a little viral something.
Yeah, some kind of virus, even if it wasn't that. I mean,
it's
but
nice to have that
it's
nice to have that in your back pocket. You know, like when you're sick, you're like, I got that, and it's gonna take care of it.
Mm-hmm.
All right, you guys. Well, I think we did the longest podcast in history.
I know. That was
going on 2 hours.
That
here.
was like 2 separate stories. Honestly.
It could be. Maybe we'll split it up.
That was an amazing.
Yeah, thank
journey.
you so much for sharing.
So well, because of your persistence and your amazing.
You have to be your own advocate.
You really do.
Amen
That
to
is
that.
the biggest.
My last oncology visit, and she was going over some blood work or starting to, and I was like, oh yes, I know. I saw my ALT was a little bit high. I know what to do. I'll get out my castor oil pack tonight or whatever. I'm like talking to her, like she goes, what do you do for a living? Are you a doctor? I'm like, no, I'm a teacher. She goes, feel like you're explaining the blood work to me. She's like, I've just never had anyone talk about it like this before. You have to be your own advocate and you have to learn. You have to take the time to do the research and to learn so that you can, you're
it's a
best
lot to
advocate.
navigate,
Yeah.
like with that big diagnosis, and especially being in all the like having all the fear, and there's a lot of things that come along with it. Both my parents had cancer, so went through it a couple times, but I was there to help them navigate it.
Right.
And I'm like, I can't imagine people navigating this with, I mean, I know the medical terminology. I know their labs coming back. I'm able to help them read it. But like, if you don't have that, you're starting from scratch. Like that is overwhelming. And especially since most doctors don't have the time to explain it. It's just like, do this, here's an appointment, and it's 6-8 weeks out. This is the waiting game. Like you're saying, I hear it from patients all the time too. Like I just had one the other day who she's been bleeding out the rectum. They think it's colon cancer, but they can't get her in for 8 weeks. She's anemic. And like, she literally called me like, what do I do? And I'm like, I don't know what to tell you to do. Like these doctors, they just, they don't tell them anything. Like I feel like there's a lot of people that just are really frustrated with where they're at with a lot of this. But
well,
anyhow,
we're wrapping it up.
I know. Sorry. Here we go.
No, this was amazing. Thank you so much for sharing your story. And we'll pop a little picture of you and your little kitties in this,
let's do that.
Video. Love you.
Love you. And if anybody out there wants any more information, just visit our website, deeperhealing.com. You can also learn about our online courses. We have a mold course. We have a couple other courses. So just check out the info and we will see you next time.
We hope this episode inspired you. Here's how to go deeper. Visit deeperhealing.com to become a patient. Online, we have loads of courses and a free toxin quiz. Subscribe and please, please share this episode with someone who needs it. It's always that one-on-one support that really gets people to find deeper healing. Remember, this is educational content, not medical advice. The information shared here should be discussed with your own personal healthcare provider. If you're excited by listening to the medical experts or the personal recovery stories on here and you want to start your own deeper healing journey, go to deeperhealing.com and start your process.